5 NCLEX questions of the day. Question number 1. The nurse takes care of a client with Parkinson's disease. Which description of Parkinson's tremor is incorrect? A. Tremor usually occurs at rest and improves with movement. B. Tremor usually occurs with movement and improves with rest. C. Tremor usually starts unilaterally and becomes bilaterally as the disease progresses. D. Pill rolling is a classic sign of Parkinson's tremor. We are looking for an incorrect statement about Parkinson's tremor. From my Parkinson's video, we know that Parkinson's tremor is a resting tremor, which means the tremor is worse at rest and improves with movement. For example, pill rolling is a classic sign of Parkinson's tremor in which the tremor appears like the client is rolling a pill or other small object between their thumb and index finger, and the tremor disappears when they try to use the fingers, such as picking up a pen from the floor, and reappears when the fingers are at rest. With that in mind, we can say choice A and D are correct statements. Since choice B is the opposite of choice A, that means the statement about Parkinson's tremor in choice B is incorrect, which makes it the correct answer for the question. You can rule out choice C even if you are not sure whether that's a true statement or not. In fact, since choice A and B are opposite of each other, it is very likely that the correct answer is one of them, and you can easily rule out both C and D. Question number 2. The nurse assesses a post-op patient who had an appendectomy under anesthesia 10 hours ago. Based on the nurse's note below, highlight findings that the nurse finds concerning. Abdomen is soft and non-tender. Incision is clean, dry, and intact. These are normal findings. A distended abdomen after any abdominal surgery should be investigated to rule out internal bleeding or peritonitis. No bowel sounds noted. Patient denies passing gas. Even though small bowel function can return within hours, bowel function should be expected to return slowly in the next 1 to 2 days. Measures such as chewing gum, early intake of a clear liquid diet, and early ambulation can help with return of bowel function. So, that's not a big concern. Indwelling Foley catheter is in place with brown-colored urine. Brown-colored urine is not a normal finding, as it could indicate kidney damage. Skin feels warm to touch and appears flushed. That could be a sign of fever, and it's an abnormal finding. Patient is asleep, but wakes up to voice. Oriented times 4. Denies pain, but complains of jaw tightness that the patient can barely open the mouth. That should be an alarming finding, as this could be masseter spasm, which is a symptom of malignant hyperthermia. Malignant hyperthermia is a reaction to some anesthetic gases that results in a hypermetabolic crisis. Patient has shallow breathing. The current vital signs are 39 degrees Celsius, heart rate is 115, blood pressure is 110/65, respiratory rate is 30, 92% on 4 liters of oxygen via nasal cannula. It looks like the patient is having a fever with tachycardia. BP is stable, but appears to be in respiratory distress with shallow and fast respiratory rate or tachypnea, and oxygen saturation is on the lower side, even with 4 liters of oxygen per minute. Putting everything together, it looks like this post-op patient has possible kidney damage, is in respiratory distress, running a fever, and having muscle rigidity in the jaw. With that in mind, let's move on to question number 3. Based on the assessment, the nurse is concerned that the patient might have which condition? A. Atelectasis. B. Malignant hyperthermia. C. Appendicitis. D. Peritonitis. Based on what we discussed, we can rule out choice C and D because the GI assessment was benign. Please watch my videos on appendicitis and peritonitis. Could it be atelectasis? What is atelectasis? Atelectasis is the collapse of alveoli, or the tiny air sacs in the lungs, which interferes with blood gas exchange. That may explain the respiratory distress. What about malignant hyperthermia? What is it? Malignant hyperthermia is a reaction to some anesthesia that results in a hypermetabolic crisis with muscle rigidity, fever, respiratory distress, and renal failure. So, the correct answer is B. Malignant hyperthermia. and the word hyperthermia gives you a clue about the fever. Masseter spasm or jaw tightness is a common symptom of malignant hyperthermia. Please watch my video on malignant hyperthermia. Question number 4. Now that the nurse suspects it's malignant hyperthermia, which medication would the nurse expect the provider to order to reverse malignant hyperthermia? A. Acetaminophen. B. Acetylcysteine. C. Dantrolene. D. Protamine sulfate. Acetaminophen or Tylenol helps to lower the fever, but is not going to reverse the problem. Acetylcysteine may ring a bell with you, as it is the antidote for acetaminophen overdose. They both start with the prefix ACET. Choice A and B are both ruled out. Choice C says dantrolene, which is a muscle relaxant, and it is the only antidote given to reverse malignant hyperthermia. So the correct answer is C. Protamine sulfate is the antidote for heparin overdose. Question number 5. The nurse is providing education to residents in a senior home about Parkinson's disease. Which statements made by the nurse are correct? Select all that apply. A. Rocking back and forth before getting up will help you initiate movement. B. You should purposely lift your feet while walking. C. You should take your Sinemet with high-protein foods to help with absorption. D. Keep yourself hydrated since you are losing fluid from drooling and diarrhea as the disease progresses. E. Your weight should be monitored once a week. When you think of Parkinson's disease, which keywords come to your mind? Maybe the classic Parkinson's tremor as discussed earlier. There is also muscle rigidity that causes stiff movement. And they generally have slow movement, or what we call bradykinesia, which is the strongest indicator of dopamine deficiency in Parkinson's. Let's go back to choices A and B. They both sound like great tips for a client who has stiff and slow movement, and they are, in fact, very useful tips. Rocking back and forth helps with bradykinesia, and purposely lifting the feet while walking helps with muscle rigidity that some clients may describe as if their feet are glued to the floor. Okay, let's move on to C, D, and E. They are all related to nutrition and hydration. What do we know about nutrition and hydration in Parkinson's? Clients with Parkinson's disease are definitely at risk for malnutrition due to their physical restraints, depression, and dysphagia, or difficulty swallowing as a result of rigidity of the facial muscles. So getting weighed once a week is a good measure to monitor for malnutrition. Adequate hydration is also important for Parkinson's clients because constipation is common in this population due to the decreased mobility and slowed peristalsis. So hydration and fiber should be encouraged. Choice D is only partially correct because diarrhea is not a symptom of Parkinson's. Choice C says a high-protein diet, which is recommended along with a high-calorie diet for Parkinson's, but it should be avoided when taking scheduled Sinemet dose because protein interferes with Sinemet absorption. So the correct answers for this question are A, B, and D. Thank you for reviewing the questions with me. Comment below if you want to see more NCLEX review videos. See you next time.